Hi there, this is PT Pete. I have a background in physical therapy. Welcome to my channel. Low back pain affects millions of people worldwide. But did you know that the prognosis for acute low back pain is generally favorable? The probability of being pain-free after 6 weeks is 40%, and by the end of 1 year, that probability rises to 72%. Even better, disability has an even more favorable prognosis. By the end of 6 weeks, the probability of having no disability was 55%. And by the end of 1 year, that probability rose to 83%. But here's a catch. Recurrence rate is high. Recurrence of acute low back pain within a year can be as high as 66% to 84%. Because lifetime prevalence for low back pain is as high as 84%, it's important to equip yourself with knowledge and skills to manage it effectively. This means that the intention of physical therapy isn't to fix or stop low back pain from ever occurring. It's a means through which a patient can enhance their confidence in managing their pain independently. The recommendation is to take active rest only if needed, but still stay as mobile as possible. Early mobility and return to graded activity, despite a little pain, is desirable to maximize recovery.